Let me make sure this is working. Okay. Hello, followers on Facebook. I've figured out how to get this up and going on my new Mac that I talked about on my last video. This is the second live video that I'm doing in my pandemic series. So I have cross-posted this to all of my different pages and my private group that I started for my book manuscript, which I talked about on my last video. And hopefully these videos will continue to encourage you, support you through this pandemic. And hopefully my experiences that I've had up to this point will help support you as you experience many of the similar experiences that I had, but through trauma. As I shared on my last video last week, in 2010, I spoke up against abuse in medicine, and that placed me where I was at the time of my accident when I was hit by a semi-truck at 65 miles per hour. Speaking up against abuse in medicine very nearly cost me my life. So after that, in 2010, I would have never imagined that I'd end up speaking up against abuse in medicine again last year in 2019 when I testified against my former medical school dean. But I felt convicted to do so in my spirit, so I testified. And I'll share more about that in a little bit. So I wanted to continue on in this second video, sharing a little bit more about my journey after experiencing that near fatal accident. And after I share about my journey, I'm going to share, I wrote a few notes down to keep myself on track. I'm going to just share some updates that I've seen in regards to the medical community. I'm in groups with tens of thousands of physicians on the front lines and doctors who are ready to speak up against abuse in medicine collectively, which is very encouraging. Today is National Doctors Day. So I just read an article before I came on here from a doctor who said that today is anything but happy because of what they're experiencing right now. But I think that every doctor should take a moment to be proud of the sacrifices that they're making and the sacrifices that they've made along the way. Our medical education alone is such a huge sacrifice, and I'll share more about that in a little bit as well. I also wanted to talk about the different World Health Organization points that I saw on their media briefing today so that I can help educate my community. Because sometimes I get messages coming in from Facebook friends, and it's not recommendation-backed medical advice. So I want to do my part to help maintain good information and not misinformation. And then I just wanted to share a couple of points that I've seen along the way since the last video in regards to humanity, because during times like this, you see the reality, but the reality also includes unity and humanity. And it's really heartwarming to see some of the stories that I have seen. So before that, I saw a couple of posts that were really funny. One of the posts was like, what are you going to look like when you come out of quarantine? And it was a giraffe who was all expanded, and it plopped over and fell forward into a puddle of water because it couldn't support itself, which is funny. And I also saw a post talking about, what have you ate last in quarantine? These things right here are going to do me in. I have ate far too many Rice Krispie treats during the stay home, flatten the curve period. So anyway, I want to continue on with my journey from the beginning of 2011. I said that my accident was in 2010, December 15th. In 2011, after experiencing the loss of everything that I experienced, like I shared in my last video, many of the things that people are experiencing now, loss of health, loss of careers, loss of finances, loss of a sense of certainty, loss of stability. Those are all experiences that I had very abrupt back in 2010 into the beginning of 2011. And you go from a point of, at least I did, from a point of denial. And this is really an overview of what's in my book manuscript. You go from a point of denial and, fear and I get all kind of shocked, is this really happening? To a point, at least for me, where my accident forced me to slow down. That semi truck also knocked down all of the walls that I had around me. And in slowing down, I finally was put into a position where I started to grieve. And I think people going through this pandemic, I think people are going to be forced to slow down, and they're going to, last video I talked about reflecting on what life is about. And I think that if the parallels continue between what I experienced with my accident and what I'm seeing people experience globally with this pandemic, I think people are going to grieve in a multitude of ways. For me, it was finally grieving the death of my dad. My dad died during the first week of my third year of medical school at my base hospital at the age of 53. Like people who are at higher risk for this COVID, my dad had preventative risk factors. He smoked and he was overweight. He also had a history of an old MI, myocardial infarction, a heart attack on his EKG. Those are all factors that increase the risk for worsening outcome with COVID. And so for me, I didn't grieve after my dad passed away. I didn't take time off of medical school. I think many people cope, use an unhealthy coping mechanism in life when they don't want to deal with things. They work, or they'll do other things, whether it's drinking alcohol or using nicotine or shopping excessively or sex. They use those coping mechanisms that I used, versus allowing yourself to slow down and to process that and to actually give yourself the gift of grief. And I have found that grief, as painful as it is a gift if you allow yourself to go through it. And you may need to have professional support, a professional therapist walking through that grief with you. I recommend that. I have worked with therapists since my accident, psychologists, and I have a wonderful friend, Shari Botwin, and she does telehealth. So if anybody is interested in being able to have at-home therapy during this time, she is somebody that I would recommend. Her name is Shari Botwin, and she's been on several media networks during all of this, trying to help encourage people to get through this time. So I think that's where I'm going to take people through in terms of my journey and just the parallels that I see with trauma and a near fatal accident and the experiences that I had and what I'm seeing globally with this pandemic right now. I wanted to share last video. last video, I shared how we were going to be meeting online with a virtual pediatrician for our kids, and we did. I'm not getting paid for sharing this. I just think this is a really cool service. So anyway, this is who we met with in Florida. So you pay, it's like a membership fee, and I see other doctors doing this too, which is a great way for doctors to get out of administration, having that overhead. It's sad to see how many doctors are working as employees now and not as entrepreneurs. But anyway, this Blueberry Pediatrics is really cool. So we paid $15. We don't have health insurance right now. We just moved back from Grand Cayman at the beginning of this year, right in time for this pandemic. And so I wanted to have access to a pediatrician if need be for my kids, Jack and Caitlin. And this is so cool. We met with a pediatrician. This is happening to a lot of doctors right now. She was just let go from a hospital. I keep seeing within these doctor groups how doctors are being cut during a pandemic, or their pay is getting cut during a pandemic, or they're being offered or asked to come in, but as volunteers, as if they are not worthy and not deserving of the pay after sacrificing countless years of education and time to become physicians. That's unacceptable. And nurses, RNs, are being offered good money to come in and work, and they should be, but so should doctors. So especially now with a lack of personal protective equipment, to diminish the worth of physicians because of these admins, it's so sad. But anyway, this Cuban physician, this pediatrician, she's wonderful. And I was looking in here, there's in this intro kit, there's a pulse ox to measure your oxygen levels. There's a thermometer. And then there's a otoscope. And then there's hand sanitizer. And I told her, I was like, this is gold right now. I'm like, I could go on Amazon, like some people are doing, in price gouge and sell that for $100, which is not right. And I wouldn't do that. I've been calling people out when I see that. It's insane what people do. It really shows people's true character during a time of pandemic to see how they behave. So that was a good visit. So I recommend them. Pediatrics, Blueberry Pediatrics in Florida. And let's see here. I talked about the doctor groups. I want to talk about what I learned on the World Health Organization today in watching their media briefing. You can find that online. I'll share that in the comments. But I have broken it down for anybody who doesn't want to sit and listen through an hour and 9 minutes into, let's see, there are 5 quick points. And I'm just going to share what I learned today from questions that were asked from the World Health Organization. And one of the questions that was asked was, people who have been exposed to COVID, can they breastfeed? And I was really encouraged and happy as a mom who has breastfed 2 children. It was shared that there are safe practices that have been established by the World Health Organization, and they are encouraging women who choose to breastfeed to continue to do so. So that was encouraging, and I appreciated learning about that. That can be found at 14 minutes into that. And then the second question was talking about medicine. And I actually had a Facebook friend today send me a post on medicine. And I know that the president had mentioned different medicine that could potentially be used with COVID. But per the World Health Organization, there are no currently clinically proven therapeutic drugs. There are ongoing clinical trials right now. The problem with those is that they have small numbers. So you can't they're small trial sizes, so that's a problem. The World Health Organization has a solidarity trial, so more information should come out of that. Another point that they had made, which is really important, is that when you get people who take this information, one, there's side effects to medicine, and two, if people are hoarding this medicine, then other people who are using it for clinically appropriate uses, they may not be able to get access to the medicine that has been helping them, say with different conditions. So it's not recommended at this time to use it off label, because then you're going to have a shortage of that medication. And then one of the other points that they talked about was some physicians, some hospitals may use it for compassionate care, but until that solidarity trial is done, it shouldn't be widely recommended. And then that was at 19 minutes into that media briefing. The next question that came up, which is a really good one, because I had some Facebook friends ask me about this just yesterday, was the usage of masks. And according to the World Health Organization, the public, their recommendations is that the public should only be wearing masks if they are sick, if they're presenting symptoms. And I know there's questions there because there's asymptomatic carriers that may not be showing signs, but may be carrying the virus. But that was their recommendation right now, is for the public to only wear masks if they're sick. And for those who are caregivers who are taking care of sick individuals, they should be wearing those masks. And they reiterated the fact that there is a global shortage of personal protective equipment. And I have seen countless posts within these doctor groups of physicians who are not being given adequate personal protective equipment, and the shortage that exists. So I would agree with that. Those are the individuals on the front line, and those people need that equipment the most right now. And another thing that has been seen with like the Italian physicians, I saw an article the other day that all 51 physicians that cared for people on the front lines, they all passed away. And you think, why is that? Well, one, they're being exposed repetitively, and two, they're stressed and they're tired, and it's a lot on the body. So we really need, the best thing we can do on National Doctors Day is, if you hoarded that equipment, to donate it. If you have any of that equipment, to donate it to hospitals and to physicians on the front line and other healthcare workers on the front line who are risking a lot just by going into work. And what an amazing sacrifice. That leads me to a humanity point. So I read another article yesterday, and it was a physician who shared that she was speeding and she has to travel for work, and she was pulled over. And the police officer, gave her a stern warning and just, said, it was irresponsible for her to be speeding, and how that would cause more issues and strain the system more if she were to have gotten into an accident. And when the police officer let her go on a warning, he gave to her 5 of his mask, his N95 mask. And I have another friend who I've been talking to quite a bit recently. He's a police officer, and I've seen the difference in his awareness of how contagious this virus is, and just a shift in his mindset in regards to the importance of doing everything we can to protect ourselves and our communities. So that story of humanity it's really overwhelming. The fact that somebody would sacrifice and just recognize a doctor who had one mask that had been being reused, and just his willingness to share with her. It's very encouraging. So that question on the usage of masks, if you want to go listen to it for yourself, that's at 26 minutes into the media briefing. And then another question was asked on the restriction of movement. And a friend of mine yesterday, Linda, she said she thought that Florida should lock down the state. And I've been watching, since moving to Florida, I have got acquainted with all of the local leaders here, the mayor of Jacksonville, the governor, the lieutenant governor, and on my page, I tag them, and I encourage you to do that also. You were given a voice, and if you have concerns or considerations, reach out to them. I sent an email to the governor yesterday in regards to a private concern, and I just passed the information along. I don't know what'll be done with it, but I feel like I've done my part as a community member. My son, this is really cool. So my son does homeschooling with Abeka, and one of the books that they just started doing is community helpers. So I asked you, what can you do to be a good community helper? And right now, if you can stay home, stay home. I understand that some people are health workers and they can't, but if you can, when you're able to, when you're not at work, stay at home and practice physical distancing. I know some people are trying to get away from the term social distancing right now, but practice physical distancing where you're at least 6 feet away from other individuals. I looked at the curves and the different countries, their pandemic curves, and the places that are lower, like South Korea and Japan and Hong Kong, they use masks, but they also use, and reading a post from a man who lives in Japan, they also practice very good hygiene, and they have stayed home and they've practiced physical distancing, and it works. So it's a sacrifice compared to what people are used to. Just like with my accident, my lifestyle, my life changed drastically at no fault of my own. But in order to move forward, I had to start accepting where I was at and doing what I needed to do in order to move forward. And right now we have to do what we need to do as a community, as community helpers, to move forward so that we can get through this. So with the restriction of movement, they talked about this today with the World Health Organization in 30 minutes in, and considerations that they had talked about. I had looked at the Florida curve, and right now it doesn't look like there's any shortage of beds. I looked at the curves for Michigan, and that was sad to me. And I've heard of experiences within the hospitals in Michigan. And then I also looked at the curve for New York specifically, and same thing. It is just extremely saddening to see the shortages and to know the experiences and seeing pictures coming out of these locations where there's shortages and people are not getting the care that they need, or there's medicine shortages to be able to even give that care if the equipment's available. So with Florida, I can kind of see why the governor wouldn't put like a stay in place order yet, because there's still facility beds open. And then listening to the World Health Organization, the considerations that they talk about is communication and education, making sure your community is on board, because you're also affecting mental health. And another consideration is factoring in human rights, because that's affecting people's individual freedoms. And then another consideration that Dr. Tedros talked about that I really appreciated, and he exudes compassion and empathy and humility. And one thing he talked about and shared was that he didn't come from a wealthy family. He came from a poor family, and he understands that people need to be able to provide, quote unquote, daily bread. And he talked about how the limitation of movement can prevent people from feeding their families. And I can speak from experience, even in the last year before my case settled with the long-term disability case that I was involved with. There were times that we had no food in our refrigerator. We know what it's like not to have enough to be able to know how we're going to feed our children, but God's always provided for us. It ultimately strengthened my faith. However, we understand living in poverty, despite having high educations. We understand that because of situations that were outside of our control, how you can fall into that situation. And so I found that very heartfelt. And then even at the beginning of the year, after being exposed to black mold in Grand Cayman Islands, we went from one home that was making us sick for 2 years, but we were stuck there because of financial reasons, that had black mold. Then we went to another home and it had hidden black mold. It's like a hidden enemy, just like COVID. And that black mold in the second home was within the walls and within the air ducts, and it made me extremely sick. It put me in the ER more times this past year than my entire life. So I understand hidden enemies. And that's what this COVID has been called. So that we left the second home because of the mold, and then mold remediation work that was supposed to be being done. And we went to a hotel in Grand Cayman just to find out that there was black mold there too that made us sick. So we had no healthy home. We were displaced. And then there are no tenancy laws or protections in Grand Cayman to prevent it from happening again. And then we came up here to Florida, to Miami on January 15th because my daughter, her teeth were destroyed from it. And we were supposed to have dental surgery for her. And this is really interesting because I was never comfortable with the idea of general anesthesia. And the fact that we had mold in our systems, mold will increase your sensitivity. You get hypersensitivity reactions. And I was actually advised not to get the flu shot this year because the other physician who understood sick building syndrome, he didn't know, and I didn't know how it would interact with that flu vaccine, because every single medicine I took in 2019, they landed me in the ER because I had hypersensitivity reactions. And the pediatrician at Blueberry Pediatrics, I expressed my concern and how I never really was comfortable with my little girl who's 4 having general anesthesia for the dental work. And I said, maybe it was a blessing in disguise, because who knows how her immune system, how it would have handled general anesthesia with the mold exposure. And she agreed with me. And she has seen plenty of patients here in Florida who have been exposed to black mold. And she knows just how detrimental it is. So before my husband was given a job, a temporary position in Jacksonville, Florida, the kids and I, we stayed up in Miami. Well, we moved around. We were nomads. So we understand homelessness also, because even though we were fortunate enough to have the money to be able to stay somewhere and have a roof over our heads, we had no stable home. We were technically homeless. So we went from Miami, and Caitlin, even though she had 2 consultations because of insurance logistics, she never ended up getting the dental surgery that we came up here for. And then we went to Marco Island, which is a really lovely older community. And then we went to Hollywood, Florida, which is a completely different demographic. And then we met my husband at the airport on February 15th. We missed our connector flight by a couple minutes. So we got a rental car and drove up to Jacksonville, and we've been up here since then. And speaking of Jacksonville, I learned yesterday how Jacksonville, so I had shared on my page how the Rhode Island governor, how she has police officers patrolling their border, making sure that New Yorkers coming into the state get quarantined and making sure that they know that they need to be self-quarantined. And until recently, there wasn't anything like that in Florida, but now certain measures have been similarly enacted in Florida by the governor. And flights still are coming in here. And one of the reports that I read just yesterday was we had the first New Yorker who traveled into Jacksonville who was positive, COVID-19 positive, and he was intercepted. But then one of the questions that I had, and one of the things that have been brought up by the World Health Organization in the countries that have done well with lowering the number of cases, was how do you then track every single one of those people who were on that plane with that individual? And how do you go back and make sure that they're all quarantined to make sure that they don't continue that community spread? So I found that quite interesting. And then let's see here with and then another humanity point that I saw down further south in Florida. I shared an article yesterday about how a Catholic organization had set up individual tents for 100 individuals experiencing homelessness, and having lived a nomadic life for that month and not having a permanent home, I appreciated the work that they're doing, because those who are living in homelessness have more vulnerability, and they're at increased risk of contracting COVID-19. And I've had, other than experiencing a nomadic lifestyle and experiencing near homelessness because of my accident and fighting the consequences of that, since being an undergrad, I have volunteered with projects and events that work with those who are experiencing homelessness, whether it's soup kitchens in Detroit. That was during my undergrad. I also volunteered for medical clinics with Dr. Jelanic. He's an ER physician out of St. John Healthcare System back in Warren, Michigan. I'm not sure if he's still working there, but he was influential in me getting accepted into medical school. And then in medical school, we went to New York, and there was a Unity project, I believe it was, with the Student Osteopathic Medical Association. I was a group leader with that program, and I never would have imagined that I'd be able to empathize on a deeper level with homelessness. But the people that I saw in New York, those were people that were very nearly back on their own 2 feet. So I always like to encourage people to understand that homelessness isn't just people on the street, sleeping under a bridge or begging for money. It's a spectrum. And a lot of people can be homeless, and you wouldn't even know. When you're couch surfing, you're considered homeless. And I think it's helpful in sharing my experiences just so that it helps to reduce ignorance in regards to that population. I also think that, just like with other conditions, I think it's important to use person first language, because these are individuals. It bothers me when I hear people say homeless people, or I read homeless people. These are individuals that are experiencing homelessness, and it doesn't define them, and it may be a temporary position within their life, but it's definitely not something that defines who they are as individuals. I think it's important to maintain their dignity as individuals. So the last point that I wanted to share about with the World Health Organization, their media briefing today came at 38 minutes into the media briefing, and people just asked about the peak. I look at the maps and everything, and you see stuff like going out to August, and nobody can really talk about when they're going to get to the peak. It's something that it looks like you just have to follow day by day, moment by moment, which is how we've been living our life since the beginning of this year. But what was important was just talking about the measures that have helped, so that you can ultimately push the virus down and then help maintain it so you don't get more outbreaks. And again, it's just social distancing or physical distancing, seeking out, locking down places that it's necessary when there's major outbreaks like New York, and then seeking out cases and putting people into isolation and then finding their contacts and putting them into quarantine. And I thought this was really interesting too, because the World Health Organization, they made sure to clarify and make a distinction between isolation and quarantine, which I thought was very helpful. And they stated that isolation, that's when you have a confirmed case, so somebody is positive. And then quarantine is the term that they use for people who are at risk or contacts of people who have been a confirmed case. So I think that's everything that I wanted to share today. I'd love to know what people are doing to stay busy. We didn't have it. Well, we have a TV now. I ordered a TV, but it's been in the box. And then I ordered a TV stand. And now we don't have much here still because we had to leave pretty much everything behind. But over there, we've got a TV and now a TV stand that I'm going to put together. So that'll be a project that will keep me busy when I'm not homeschooling my kids. Some people are using underwear to make masks. So funny. I shared that. It gave me the biggest laugh. I don't think Dr. Fauci would probably think that that's a good protective equipment, but it was very funny. So that's where I'm at now. That's what we're doing to keep busy. I want to share this. So there's a Facebook page. I can't even remember what it is about. It's about people are putting rainbows and stuff in their windows to brighten the world up. And my little girl went out this morning, and she's 4, and this is Caitlin's rainbow. So hopefully that'll brighten up your day a little bit. So that's what I have right now. I figured I would do a couple deep breaths like I did in the first video. I forgot how good that feels. Normally when I taught Pilates, we would lay on the ground. And my husband, he watched my first video the other day with me, and he's like, that was really comforting. So let's do it again. So sit up nice and straight and close your eyes. Let your body relax. A lot of times we tighten up, especially during times of stress and tension and uncertainty and fear. We're just going to let it go right now. We're going to take a deep breath in through our nose and feel that fill your lungs. And slow and controlled release through your mouth. And let it all go. And deep breath, breathe in. And exhale all of your fears. And breathe in. Think of what you have to be grateful for. And exhale. And breathe in. Releasing the need for control. And breathe in. Exhale, slow and controlled. One more time, breathe in nice and deep, fill your lungs. And exhale, knowing you are loved and you're not alone. Okay, I'll end up resharing this like I did with my first video as a watch party, and then I will respond and engage with people within the comments. I love doing that. I'm so grateful for the community that has been built through my accident, because all of my pages and my group all were born out of trauma. And I think that may be something, a message that I want to leave with you today. Life can give us really hard circumstances. They don't seem fair. They're not fair. Life isn't fair, but we have a choice. Just like in 2011, before I started processing the grief that I couldn't experience prior, I wouldn't let myself experience prior, I realized I had a choice. I could either grow bitter or grow better through that experience. And I feel like that's something that I can leave the world with right now. This may be a terrible experience. It is in so many ways, but just like the shared experiences of humanity, there are so many opportunities to show humility and love and unity and humanity. There are so many ways that tragedy and trauma and circumstances that create uncertainty can allow for personal and spiritual growth. And I am who I am today. And I love who I am today. I love who I have become through so much pain, loss, hardship, and adversity. I had to go through that to get to where I am today. So hopefully that final thought will help encourage you. Even in really bad times, beautiful things can be born. So I send you love. I send you peace that surpasses all understanding, that comes from only above. I pray you stay well. I pray your family stays well. And I trust that we will grow as a world, as a community through this. Take care.